This is our Fentanyl Crisis Forum. We're excited to have folks to participate for this particular forum for our crime prevention meeting. And I think you'll hear a lot of interesting perspectives from many different systems that are impacted by this crisis. So very excited to have everyone who is joining us now. My name is Michelle Milam. I'm Crime Prevention Manager for the Richmond Police Department, and I will be your moderator for this particular forum. So if you have questions, there is a question and answer feature that is going to be located that you can use to drop questions, and we'll make sure that we ask those questions to our panelists when it's time. And then, there will be a poll at the end of this meeting just to kind of get some ideas and thoughts from you all of what you think is important in terms of addressing this crisis. So really appreciate you for spending your time in the evening participating with us on this forum. And we have some wonderful representatives from both the police department, the district attorney's office, the fire department, our AOD county office that are going to be talking a little bit about the impact of the fentanyl crisis on all of our systems. So I'm very excited to have us here. So before we get started, a few housekeeping issues. Again, if you have questions, we will have an overview from all of our panelists. It'll be a short overview, and the overview will consist of the impact of the crisis currently, what some of the challenges are, and what some of the opportunities are for us moving forward in addressing this together as a community, because it is a public health crisis. And then we'll have opportunity for question and answer, and really for you to ask questions that you want to hear from any of the panelists or all of them. And I'll be fielding the questions from both the Q&A, so feel free to drop those in there as you think about it. And if you think about it now, that's fine, and I can always come back to that during the Q&A period. And with that started, I want to really open this up by allowing our Assistant Chief Simmons to kick us off and to provide us with a little bit of an overview about how the fentanyl crisis has really hit our community. We see a lot about it in the news. We hear a lot about it. It's changed the way that we respond, quite honestly, as law enforcement. And, we really are looking at ways that we can work with all of our systems and all of our partners, because we know it's not just something that we can enforce our way out of. And so he has a really unique perspective. So I'm going to turn it over to him.
Well, good evening, everybody. Thanks, Michelle, for the introduction and the opportunity to be on this forum and setting all this up. It's an honor and a privilege to be able to speak with everybody this evening and the distinguished guests that are on this panel. I want to start by just kind of sharing a little bit about the angle and perspective that I do come from. So prior to my years of experience in law enforcement, I was a California Board of Pharmacy certified pharmacy technician, working in both institutional pharmacies, community pharmacies over about a course of about 10 years, with my last place of employment prior to law enforcement being with Kaiser Permanente in the Sacramento area. So I've got quite a bit of experience working with fentanyl and with other prescription narcotics similar to fentanyl. And I wanted to start by kind of framing the conversation. So fentanyl, we definitely are in a crisis in our country as it relates to a lack of public knowledge on fentanyl and understanding just how addictive fentanyl is. But I also want to just include in the conversation, not just fentanyl, but the overarching problem with prescription narcotics in general. The reason why, in my opinion, fentanyl gets a lot of the attention is because fentanyl is measured in micrograms, and your regular narcotics that are prescribed by a physician and you receive through a pharmacy are normally measured in milligrams. And so there's a significant difference in potency when you're looking at your traditional opiate-based narcotics that come from a pharmacy as compared to fentanyl, which is, again, measured in micrograms, significantly more potent, significantly more addictive, and significantly more deadly. And what I mean by deadly is the capacity to overdose accidentally is a lot more severe than the others. So just to frame some of this, so some of the things I learned crossing over from working in the medical field to working in law enforcement, I remember very vividly my very first interaction with somebody on the streets in Richmond who was illicitly selling Vicodin, which is an opiate-based prescription narcotic that is commonly prescribed for folks that are just in pain or recovering from surgery or under the care of a physician. And this individual had sandwich bags full of the Vicodin pills. And at the time, I was a brand new patrol officer, and I remember stopping this individual, and we had to call a supervisor over to basically approve the arrest before we were able to execute the arrest and bring the individual to the station for booking. And my supervisor at the time looked at what I was arresting this individual for, and his response kind of shocked me. And it was, you can't arrest for this. These are pills. These are his prescriptions. This is his medicine. You can't make an arrest for this. And I politely and as a junior officer, I shared with my supervisor just where, in fact, in the health and safety code and in the business and profession code, these violations were. And in fact, at the time, they were felonies. But that's when it first dawned on me that there was a huge gap, at least within our own department, between law enforcement understanding what the capacity was with these prescription drugs and understanding what they are in comparison. So I ended up developing a training class that got picked up by the state of California that I taught to many Alameda County district attorneys, CNOA, which is California Narcotics Officers Association, and really trying to get education out there to the law enforcement community about this issue. And I started to focus on it on our streets, and I started to see a lot of emerging trends. For example, promethazine, which is a common cough medicine that is prescribed, that is often mixed with codeine. You can actually get promethazine with codeine, and started to see that in our schools. And I started to see that with our youth, where they were mixing this cough syrup that had codeine inside of it with sodas. And it was a way to mask the smell, the look, and the taste of the cough medicine with a soda, and a way to get high. And people began to sell these things to our youth, and youth began to consume this particular drug in this particular way at parties. And then it wasn't too long after that, we started to see the rise of what was known as Skittles parties. And we actually had a few of these Skittles parties in Richmond, where they were raves or they were house parties. And instead of there being a cover charge to get into these parties or get into these raves, the price for admission was you had to bring pills. And there was a big jar left at the entrance, and the kids would show up and they would empty their pills they brought into this jar or this bowl. And that was your price of admission. And then throughout the course of the evening, people would either go to the bowl and take whatever was inside of the bowl that they pulled out, or somebody would be passing the bowl around, and you just grab something out of that bowl blindly, not knowing what you were taking. And we saw a lot of people get sick. We saw a lot of our youth end up in the hospital, end up in the emergency room, in some very, very scary situations. The interesting thing was, in one of these cases, when the police were called to this particular party, they had a very difficult time trying to identify what the crime was. There wasn't a bunch of alcohol. The room wasn't full. The party wasn't floating with alcohol. And they didn't recover a bunch of traditional drugs that they had been trained to be able to see and identify. What they found were these pills, and they didn't quite know what they had or what was going on. And so conversations and forums like this are really, really important from an education standpoint, not just for law enforcement officers, but for the public and for our communities to really understand that yes, prescription drugs, prescription narcotics, fentanyl, and other opiate-based drugs, they're safe when under the care and direction of a physician. They're not safe when they're being used outside the care and direct supervision of a physician. And I think that's a message I would really like to have conveyed as we continue on in this conversation this evening, that if you have these drugs just sitting around in your home because you were once prescribed them for a legitimate reason, but you no longer need them, My encouragement to you all is to find a way to get rid of them. In the lobby of the police department right now, we actually have a prescription drug bin. You can drop them off. Most police departments now have those in their lobbies. Pharmacies will now take them back. Just get them out of your homes, get them out of your medicine cabinets, so that they don't accidentally end up in the wrong hands, in the wrong situation for the wrong reasons. So I just wanted to kind of frame the conversation as we start talking about it with really understanding that this is both a law enforcement issue and it's a public health and public safety issue in general as well.
Thank you so much, Assistant Chief Simmons. Really appreciate that and that framing of it. Up next, we're going to have a short presentation from our behavioral health, alcohol and other drugs division from Contra Costa County. Fatima Medelsol is here with her team, or her director, and the director and her team is going to be able to kind of give an overview of what prevention and intervention services are currently available and what the crisis looks like. Really appreciate you being here. So I'm going to turn it over to Fatima and her team.
Thank you, Michelle, and thanks everybody. We appreciate the invitation. We are honored to be here. And my name is Fatima Matasol. I am the Program Chief of Alcohol and Drug Services. We work under Behavioral Health. So Behavioral Health is the division. We're under Health Services Department as well. And before I let Mariela talk about her presentation, I do want to say a couple of things. That the opioid crisis that we're seeing right now, it really started in the early 90s, and exactly along the lines of what Assistant Deputy Chief Simmons just explained. In the early 90s, we saw a rise in the number of prescriptions that were prescribed with regards to opioids, and that the opioid overdoses started there. The second wave included a rise in the use of heroin, and that was around 2010. The third wave included fentanyl, and that really started in 2013. And the final wave, which is where we are right now, combines fentanyl and also stimulants. My job is to provide treatment services to people in the community, provide prevention. The work that we do with Mariela, it's really falls under prevention. How do we prevent that all these unused prescriptions or going to the right place? We wanted to make sure, back in 2010, that they didn't go in the waterways, because that is not a safe place to eliminate them. And that's when we started to work on all these bins where you can dispose your unused or unused medications. And then the final thing I do want to say, as part of us delivering prevention services and treatment, is that when somebody, not everybody, but when somebody is misusing medications or using opioids, it's a cry for help. These are people that need support. And that is the reason why we also add treatment to the services that we provide. Along with Mariela tonight, there's Cletus Shelton with me. Cletus is the program coordinator director of the Richmond Health and Wellness Center, which is a residential facility for men, offers detoxification services, and I will let him talk at the end. But for now, I wanted to make sure if there's anything you're going to take away tonight is not only what was said about the proper disposal of the medications, but also to remind you that when somebody is using opioids or fentanyl, what they're really saying is they need a lot of help and support. Mariela?
Yeah, thank you, Fatima, for that introduction and sort of background to what I'll be talking about. My name is Mariela. I'm the coordinator for the Contra Costa County Meds Coalition. MEDS stands for Medication, Education, and Disposal Safety. We are funded by the county in order to, again, do primary prevention of this work. So we do a lot of community-based education. And so today I'll be giving you sort of a preview of the type of education that we put out to the community, okay? So starting with some national data, in the year 2021, 106,000 people in the US died from drug overdose. I want to point out that in 2020, it was around 95,000. So that number has significantly increased just from a year, right? And that's more than the number of deaths from car crashes, HIV and AIDS, and gun violence, okay? And the population with the highest risk for misusing these prescription drugs or for using these drugs for non-medical purposes is ages 18 to 25. So that's around young adults, right? But I do want to note that we're seeing trends of younger people being impacted by this crisis now too. So what does this look like on a county level, right? What does this look like in Contra Costa? I know that the dates are covered on the bottom, so I apologize, but it goes back all the way from 2007 yearly up until 2021. Like Fatima highlighted, there are sort of three main spikes. The most recent one really highlighted here, showing the prevalence of fentanyl in our street drug supply. Okay, so these are any opioid related overdose deaths. So fentanyl is really what's making these overdose deaths spike here in our county. Okay, so the three most dangerous or misused types of prescription drugs include opioids, or what people call painkillers, stimulants, and then central nervous system depressants or sedatives. So that looks like, for example, with painkillers, that can be oxycodone or OxyContin, Vicodin, codeine, Percocet. Fentanyl also falls under opioids. Stimulants include Adderall, Ritalin, and Dexedrine, namely, and then with sedatives, that includes Xanax, Ativan, Valium, Ambien. Among the most misused of that category is probably Xanax, especially amongst youth. Okay, they're looking for a very sedated effect when they're seeking out these depressants. So with fentanyl, I do want to point out, like Chief Simmons said, these prescriptions are safe when specifically prescribed to that person, okay? Fentanyl is prescribed in a medical setting in a very controlled way. So doctors have spent years of research figuring out how to administer fentanyl in a way where it's safe and to where patients won't overdose. So they've created it to be in a transdermal patch. So if you've ever seen a nicotine patch or a birth control patch, that's how they are prescribing it to patients. Okay, so it's being absorbed through the skin at a really slow and controlled rate. However, now it's being illicitly manufactured or otherwise illegally made and sold, right? And so people who are making these drugs are lacing their pills or completely making their pills out of fentanyl, okay? It's a really cheap white powder. It's easy for them to get their hands on. And to the naked eye, these fake pills look, feel, smell the exact same as real ones, okay? There's no way to tell if a pill is safe unless it's coming from a legitimate pharmacist or a legitimate pharmacy. For reference, the picture on the slide shows the amount of fentanyl it takes to potentially send someone into an overdose. So it's about 2 milligrams, the size of Abe Lincoln's beard on the penny, or the DEA also has a picture where it's like a couple grains of salt on the tip of a pencil. So you can imagine really just how little it takes to send someone into an overdose. Okay, so that's why we're seeing an increase of fentanyl poisonings or fentanyl overdoses with youth, because they are seeking out pills illegally, like Adderall, like Xanax, Molly, cocaine, right? Really any drug that you can think of to buy on the street, looking for a very specific feeling from those drugs. And they happen to be dealt a drug that's laced with or completely made of fentanyl, and they go into an immediate overdose, okay? Because their body has never been introduced to an opioid of any kind, let alone the strongest of its kind, okay? So again, just really emphasizing the impact on fentanyl. the impact of fentanyl on opioid overdoses. This is California data from the overdose surveillance dashboard. And now, unfortunately, overdose is the leading cause of preventable death for ages 18 to 45 in the US, okay? That's a huge age group, right? And I really wanna stress that it's a preventable type of death, because this is something we have the power to stop, at least in our own city, at least in our own community, simply by knowing the signs of overdose, by knowing the dangers of fentanyl, and knowing how to respond to an overdose. Okay, again, just emphasizing that fentanyl is the most potent of its category, okay? So it's most potent of the opioid classification. It's 20 to 50 times more potent than heroin, and 50 to 100 times more potent than morphine, okay? And although it is mainly showing up in the pill supply on the streets, it can also be mixed into other drugs without the buyer's knowledge, as in the powder can be liquefied and put into heroin, or easily masked into powder cocaine, again, because it's a simple white substance. Okay, so how are we going to prevent these fatal overdoses? It's important to know that naloxone and Narcan are available to reverse an opioid overdose, okay? And it has saved lives. The more that people know how to use Narcan and know how to administer it, the more lives we can save. So naloxone and Narcan, you've probably heard it being used interchangeably. Basically, naloxone is the name of the actual drug, the actual medication used to reverse the opioid overdose. Narcan is the name of the nasal spray that carries 4 milligrams of naloxone in it. So it's kind of like a Tylenol, acetaminophen situation. Okay, so naloxone can also come in an injectable form. So you would have to draw the liquid from a vial and inject someone intramuscularly. With my coalition, we give out free Narcan, and we teach people how to use Narcan because, you know, it's a lot more user-friendly. Generally, people are less intimidated to spray someone in the nose versus inject someone with a needle. Okay. So in order to rescue someone, we really have to understand what the signs are to look out for when someone's overdosing on an opioid. So the most important is a loss of consciousness and slow, irregular breathing. So what an excessive amount of opioids does to the body is it stops any oxygen from being sent to the brain. As you know, if there's no oxygen being sent to the brain, it causes someone to breathe irregularly and causes them to become unconscious, okay? With that loss of consciousness also comes a change of skin tone, especially around the fingernails or lips. Depending on their natural skin tone, they can turn a bluish gray or a purplish black. And obviously, their body would be limp. They would be unable to hold themselves up, be unable to respond to you. And so it's important that if you're seeing these signs in a person, you try to first wake them up. So shake their shoulders, shout their name. You can give them a sternal rub. So taking a closed fist and rubbing it on their sternum or chest bone. It's pretty painful, even if you do it on yourself. So if at that point they're still not responding to you, that's a good sign that they need your help, okay? So these are basically the steps that need to be taken in order to reverse an overdose successfully. The first being call 911 for help, okay? This is especially in a situation where you don't have any Narcan or naloxone available to you. The ambulance that comes to the scene will definitely have more than enough Narcan for the person, okay? At that point, you want to administer the Narcan as soon as possible. In an overdose situation, every second counts, especially with fentanyl. It can send someone into an instant overdose and they only have minutes to live, okay? Administering the Narcan is really easy. You just insert the nozzle into the tip of the person's nose, click the trigger once. Each device has one dose to it. So once you've clicked it once, you can't use the same device again. You can also perform rescue breathing on the person to aid in getting their breathing back to normal, right? And when you've given that first dose, your 2 to 4 minute waiting period begins. So if after 4 minutes, the person is still not responding to that first dose and that CPR that you're giving them, you need to administer a second dose of Narcan, okay? The EMS systems in the county, I work with a little bit on gathering some overdose data because, you know, they're responding to overdoses all the time. And there have been reports of needing up to 8 doses of Narcan to revive someone, okay? You can probably guess that that situation was fentanyl related, again, because of the extreme potency of fentanyl. Or it could be that someone just has a really excessive amount of another opioid in their system. Okay, so that's why I really emphasize calling 911 as the first thing, because if you only have 2 doses of Narcan on you or no doses of Narcan, the ambulance definitely will have some. Okay, and then lastly, lie them onto their side in case they vomit or foam at the mouth, and monitor them for several hours because there is a chance that they could fall into an overdose again, even after you've revived them. Okay, so do not leave that person alone if at all possible. I just want to quickly mention the Good Samaritan law in California. I really like to emphasize this when I talk to youth or teenagers. Unfortunately, there have been situations where teenagers will try drugs together, right? There will be, let's say, a group of 4 teenagers who all decide to buy the same pill from the same dealer. 1 out of the 4 kids falls into an overdose, and those 3 other kids with them might want to flee, right? They might want to leave the scene. They don't want to be there when the police arrive or when first responders arrive because they're scared of getting in trouble. I like to remind them that the Good Samaritan law will protect them if they happen to be under the influence at the time that they're calling 911. Okay, obviously there are some limitations to that, like with any other law. So they would not be protected if they were the ones who actually dealt the drug to the person that they're then overdosing on, or if they were driving under the influence at the time of the emergency. Okay, so how do you get naloxone? You can get it from your doctor through a prescription. You can also get it at the pharmacy. It would be behind the counter, so you would have to talk to the pharmacist on staff. The price does vary, and so we really recommend using the free resources in the county. My coalition does give them out for free to any community member. The recovery clinics are all equipped in the county to have Narcan at their locations. There is some legislation in California right now talking about making Narcan available over the counter. Nothing's official yet, but the hope is that it will be sometime this summer. Okay, and then lastly, this is my contact information as well as Jessica's, who's the prevention coordinator in the county. I encourage you to reach out to us for anything prevention related, as well as Fatima. We do give these presentations and lots of other educational materials, not just surrounding fentanyl, but any type of prescription drug, to virtually any audience in the county that requests it. So I encourage you to reach out to me or visit our website where you can request any of our services. Thank you.
Thank you so much. And that's a really rich presentation. Is there a way that we can also get that to share with people if they'd like to see it? We'll rebroadcast this on KCRT, but I'm sure that people want to be able to access that. That's really great information.
Yeah, I can definitely send that to you, Michelle, if you can share that out with whoever is in attendance.
Thank you so much for such a great presentation. Really appreciate it. We're going to be moving along because we have a couple of other quick overviews from our panelists and we want to get into the questions. So we are fortunate to have our district attorney, DA Becton, here to talk about the response from the district attorney's office. And that will be followed by Lieutenant Lopez from Richmond PD. And finally, it will be followed by Deputy Chief Fire Chief Osorio from Richmond Fire. And we do also have LaShante Smith from the school district. So I'm going to turn it over to DA Becton first. And the kind of framing of this part of the panel is just going to be kind of a short overview of how you are seeing the impact of the crisis and what are the challenges and opportunities.
Thank you, Michelle. And I'm Dinah Becton, District Attorney for Contra Costa County. And I would like to share with you the approach that we've taken from the District Attorney's Office, particularly for those who are suffering from drug addiction. I strongly believe that the fentanyl crisis that we've been talking about this evening, fentanyl, and particularly as it has been mixed with other drugs, is not one to be solved by the policies that we used in the past to fight drugs. We often call it the war on drugs, and that approach we have seen over time really failed us because it focused on criminalizing drug use and possession, and that resulted in mass incarceration and also had a disproportionate impact on marginalized communities and particularly communities of color. And so my preference is for a public health approach to the fentanyl crisis, an approach that prioritizes harm reduction and treatment rather than criminalization and punishment. And I want to be clear that when we talk about prioritizing harm reduction and treatment, we're talking about those who are addicted as opposed to those who are peddling drugs in our community and those who are selling drugs and in other ways possibly committing harm to our community. This is not an approach that is for that group. And I think we'll hear, I didn't hear a lot from our we heard a lot, I'm sorry, from our health professionals, but certainly just highlighting that the public health approach relies on measures that are less punitive, including the administering of the naloxone and also the Narcan, drug testing being available, providing access to treatment being available, and also trying to get to the root causes of addiction. And then certainly working with communities and other justice partners, recognizing the importance of addressing the fentanyl crisis in our communities, engaging people who use drugs, their families and their communities to develop solutions that meet the unique needs and priorities. From a law enforcement perspective, I believe that the public health approach seeks to reduce the involvement when we can of law enforcement and prioritize the public health response. We have, I would say, for the past almost 4 years now, shifted our approach so that for people who are suffering from drug addiction, that those cases are referred to healthcare as opposed to criminalization. And much of that policy is really shaped on the fact that we can't prosecute our way out of a person who is addicted to drugs. Again, my final closing would just be to emphasize that the policies we're talking about are not for those who are selling drugs in our community. When those cases are brought to us, we have plenty of tools to prosecute. So those are my comments. Thank you.
Thank you so much, DA Becton. We really appreciate you taking your time out to be here and to participate and to represent the District Attorney's Office in this perspective. So thank you so much. Appreciate your comments. I am going to now shift to Lieutenant Lopez, who will give some comments. We heard some earlier from Assistant Chief Simmons on the law enforcement perspective. And again, same question or same, piece posed, the impact of the crisis that you're seeing, any challenges or opportunities.
Great, thank you. My name is John Lopez. Currently I'm a lieutenant for the Richmond Police Department. I'm assigned to our Investigations Bureau. Some of the talking points I'm going to go over are what we do when we get a case in the Bureau when it related to narcotics or fentanyl, and then what our patrol officers do and detectives do when they receive a case. So I should let everybody know that, within our Bureau, we have 3 different units. We have obviously we have our homicide unit, and we'll have our domestic crimes unit, and then we also have our general crimes unit. And so I manage those 3 sections. There's a case as the DA was mentioning, a felony case where we have a distributor who was arrested for narcotic sales. In those cases, we'll get routed to our general crimes detectives, and they would handle the case, do the follow-up, and then file the case to the DA's office. A lot of our misdemeanor cases, they will go straight from the patrol officer who is investigating that case, and they will get routed to our in-house deputy DA that works here at the Richmond Police Department. And he determines whether the case is going to be filed as a criminal complaint or not. So that's kind of how the system works within the Bureau and within the city. As I was mentioning, so a lot of times it's whether it's going to be a misdemeanor case or a felony filing case that we actually handle. I think a lot of the opportunities and what the community can do to assist were mentioned earlier by a great presentation. I learned a lot. I loved it. Just personally, being on the streets as a patrol officer, I've come in contact with individuals who have overdosed, and I felt that they were possibly overdosed with some kind of narcotics. I couldn't tell you that it was fentanyl. I just know that they were hard to wake up. They were breathing. They had a pulse. It was very scary, I should say. It's a very scary situation for not only that person, but for those that are around. I think what the community members did during that incident and many other incidents is they immediately called the police and stayed with them and tried to wake them up. Same as what we try to do as police officers when we get there. We do the same thing, try to wake them up, do the stern and rub. We used Narcan a couple times, woke up this individual. The first one, they didn't wake up. The second time they did. And I've seen them when it's been used more than 2 times even. So overdoses are very scary to say the least. But the most important thing that the community can do is definitely to call 911, stay with them and try to wake them up and try to help them as best you can. So, I mean, again, there's a lot mentioned already within the presentation. I think if you have any questions, please feel free, and I'm here. Thank you.
Thank you, Lieutenant Lopez. We will now hear from Deputy Chief, Fire Chief Osorio to talk about the standpoint from Richmond Fire. So I'll turn it over to the Deputy Chief.
Good evening, everybody. My name is Aaron Osorio. I'm the Deputy Chief of the Fire Department. OVC operations, and one of the operations that fall under that division is EMS. So that's gonna be our medical aspect of the fire department. For us, it's a little bit different. We're more on the response side of this pandemic epidemic we're going through. And so I'll just give you some figures. We pulled some data from 2021 till today. So about a little less than 2.5 years. It's very difficult because the way reporting gets done, we don't separate by type of drug. So we have a broad category of responses that are for overdoses, but that could be other substances. But predominantly it is going to be opioids, and we see due to the potency, because of how much Narcan we have to give, that it's most likely fentanyl involved in a lot of those overdoses. So since January of 2021, we've gone on 117 overdose incidents in the city of Richmond. A good detector of what of the number of overdoses, though, really is how many times we administer Narcan, because something we may be dispatched to an incident and it doesn't come in as an overdose. That isn't the primary complaint. A family member would say, I have a family member that's having difficulty breathing, or they seem like they have their altered level of consciousness. So there's a lot of different call types we could be sent to, and through our screening of the patient are led to believe it's possibly an overdose. So a better gauge of the number of calls we go on that are overdoses would be that Narcan administration. There was a few figures that I thought were interesting. If we went through and filtered all of our Narcan administration, there was 81 occurrences since 2021 that were overdose and would have led to a death within the city of Richmond. Sorry about that, the lights. And that's really shows like the positive impact of being able to add that to our scope of practice by giving Narcan. there was also 11 times in that same time period that prior to our arrival, someone administered Narcan, either a family member or oftentimes it's going to be a police officer from the Richmond Police Department. So the Narcan has been a really effective tool in preventing death within the city of Richmond on a lot of these calls. You know, the impacts that we have on our organization really are more in the level of danger for responders. If anybody's ever administered Narcan, oftentimes someone who is overdosing isn't quite aware of what's going on. And when they're abruptly brought out of an overdose, they don't even realize it, but they can be very combative. It could be kind of a dangerous scene. So that's some of the impacts we have had to deal with. And we try to mitigate that by how hard we dose folks with the Narcan and bring them back slowly. So hopefully they don't come out in this agitated state. And then the other impacts would be other incidents that appear to be related. It's hard to really pinpoint. There's a lot of responses for the unhoused, fires outside that all tend to be a little bit related to this same topic. The Narcan, health department went over a little bit. We can't stress enough the importance, if you feel you have a family member at risk or if you're at risk, obtaining Narcan. Opioids and narcotics, they will depress your respiratory system. And that's really the protocols we look at to administer Narcan. We are only allowed to administer to folks who actually present with certain symptoms, and primarily it's a respiratory distress. So the respiratory rate has to be down below 8 breaths per minute. These are county protocols that are established that we must follow. So someone that can come up and tell us, I think I overdosed, we're not allowed to give them Narcan. So that's why I say the Narcan administration is a great sign of how much we're responding, because they would have had to meet these criteria to even be given this medication. We don't just give it to anybody just because they say they're overdosing. But it saves lives, and it's a really important tool to utilize if we can get it. The last thing I really just wanted to talk about was that within the county, there's a joint between the county health department and the ambulance company, which is AMR. There was a pilot program that's been going on. That's a Leave Behind Narcan program. That's something that we've pointed patients to. Obviously, when we respond to calls, fire department's there, and then the ambulance comes for the transport. Oftentimes, individuals don't want to be transported once they come out of their overdose. But we really encourage family members to request the Leave Behind Narcan because they can have some in their house just in case that event happens again. There's no charge to the families. The ambulance company has done really good at trying to promote it when they go to incidents that appear to have this type of issue, and notify the family members or the person there that we can leave you an extra vial of Narcan in case this happens again. So that Leave Behind program has been a really good program. It's helped save lives. And I believe right now they're in the process of petitioning to extend that pilot program for another year because it has been successful. So they've been working with the county health department on doing that. So that's really all I had for the fire department. Michelle.
Thank you so much. I really appreciate that. And I appreciate all of the presentations. We had one more quick presentation that was going to be presented by, she has joined, from the West Contra Costa Unified School District. So we do have LaShante Smith, who's here to kind of give a perspective of how the issue might be impacting the schools, what are some of the challenges and the opportunities. I'm going to try to see if I can, I know LaShante was having some tech issues, so I don't know if she's back with us. If she's with us, LaShante, we would love to hear from you for a few minutes.
Good evening, everyone. Glad to be here. My name is LaShante Smith. I'm the Director of School Climate in the West Contra Costa Unified School District. And again, apologies, I'm having tech issues. My internet went out right at the perfect time. Anyways, I was really glad to hear the presentation from everyone around what is happening across the county in regards to this crisis. As a district, we have not had any cases or we have not found any fentanyl on our campus, and we have not had any cases of students who have been found to use fentanyl on our campuses. However, we do realize that it is an issue, and we know that it's really prevalent in young people. And so what we have done is we've partnered with our Contra Costa County Office of Education, and we're training all of our school nurses and our nurses who partner with us so that they can administer different drugs in the case of an overdose. We are also working on just a whole awareness plan. Although we didn't have any cases of fentanyl on our campus, we know that we have had cases of other drug usage on our campuses. So we are definitely thinking about other ways that we can educate parents, educate students, and especially focusing on the early education, so the early prevention work, because we know that's super important. And we just recommitted we got a contract with the county again on our TUPE program, and that's tobacco use prevention and education. But through TUPE, that's where we give other kind of awareness around drugs on campus and then the impacts of drugs on campus. So we're trying to figure out a way to do a campaign around the dangers of prescription drugs and the dangers of all drugs on our campuses, and then kind of pair that with the support and the mentorship that we're getting through the county from the TUPE program. So that's what we are doing, and then just open to collaborating with any agency who wants to collaborate with the school district so that we can bring more awareness to the issue.
Thank you so much, LaShante. I appreciate you for being on and kind of talking about the perspective of what you guys are doing on campus with school climate. So thank you so much. I'm going to go and take questions now. I know that there's some questions in the chat. I do see a hand raised. So I'm going to go to Councilmember Bana, who I know has joined us. So go ahead, Councilmember Bana.
Thank you very much. I very much appreciate this forum and the opportunity for me to speak. So I'm a member of the California League of Cities, and we recently had a session about fentanyl. So I know it's a very serious issue and many people are alarmed about it. And the statistics are really alarming. Somebody had a question here about the number of deaths. I have some questions from the fire department and the police department about the number of deaths, number of arrests, number of overdose responses. I think statistics are very important so we know the dimension of the problem. And if I may, I have some questions for DA Becton. Thank you for being here with us. In that forum at the California League of Cities, it was mentioned that in Kentucky, I believe, they have turned the jail into a rehab, and it has been very successful. So instead of funneling the arrestees from jail to prison, they try to rehabilitate them. I wonder if we can do it. Second question, is it legal to test the homeless for it? I mean, City of Richmond has a huge problem with the homeless. We are trying to find a solution for homelessness. We need to know what to do with it. Without addressing the drug side of the problem, we cannot address homelessness. Can we test the homeless for drug use? Is that legal? And also the care courts that Gavin Newsom is doing, when are they coming to this area? Is there enough budget for the rehab center? What are we looking into? Because unless we have a solution for this and enough rehab centers, we cannot solve the homeless issue.
So thank you so much, Councilmember Bana. You had 3 questions, and I want to make sure that all those 3 questions get outlined for the different panelists who want to respond. And I know you had a specific question for DA Becton about treatments in the jail based on the Kentucky model that you took a look at. So I'm going to direct that first question to DA Becton, and then we'll go to testing of the homeless and unhoused population and care courts.
Okay, so I'm sorry, council member. What was the specific question about the treatment in the jails?
When people are actually somehow arrested for drug use or minor, drug trafficking, they will be treated in the jail rather than just being punished.
Okay, thank you for that. Thank you for the clarification. So I got to separate the two, because the trafficking is really going to be a person who is selling drugs in our community, or, as I said before, peddling drugs. And that is a different issue, because that is not necessarily a person who we would be recommending for treatment. Now, there could be people who are selling and using, and I suppose we could think about that as well. But if it's just selling drugs, then that's not a person that we're going to be thinking about for treatment. The other thing is that when if a person is arrested simply because they're using drugs, this really, and we are trying to prosecute those cases and hold them in custody. First of all, we don't have treatment in our jails and for drug addiction in that way. And I think it goes back to the old model of really trying to prosecute our way out of a problem that can't be solved with criminalization. We know that people who are addicted to drugs need help. It's like it's an illness, right? And that's what we've heard from our health professionals this evening. The criminal justice system does not have the capacity. We cannot lock up all the people in our communities who are drug addicted, nor do we have the solutions. If you try to take all of these cases and put them in our criminal justice system, it'll be completely overload the ability of the public defender's office to represent, overload the county's coffers to be able to pay for representation in a criminal court. And then at the end of the day, you still have a person who's addicted because we do not have the answers in the criminal justice system. So that is why I emphasize the public health approach, trying to get treatment to people, trying to make more services available for people and other options that are available through our healthcare professionals, because we are not the place where treatment should take place.
Thank you so much, DA Becton. And I also wanted to make sure that we responded to the other two questions about homelessness and care courts in terms of testing of individuals who are unhoused for drug addictions, and I guess that would depend on situational based their entry into some kind of a treatment service or some kind of a mechanism such as that, if I understand the question correctly. I don't know if anyone from AOD wants to talk about that, about testing.
Thank you, Michelle, and thank you, Council Member Bana, for the question. I do want to say at the two detention facilities, Health Services Department implements a program called medication-assisted treatment. Opioid, we're very fortunate that opioid is the type of abuse that can be treated with medication. So you probably know about methadone, but there is also buprenorphine. We're currently have an integrated model, both at West County Detention and Martinez Detention, where substance use counselors work in an integrated way with the medical provider, with the mental health provider, and the sheriff has been very open to this model. This is a grant, so we are testing it. Contra Costa was one of those few counties that didn't have substance use treatment in the jail. So we started about a year and a half ago. The integrated model works. We pre-release, we also prepare individuals so that when they're released, they are either given an appointment to continue treatment outside. They're also discharged with prescriptions, and they're also discharged with Narcan to prevent an overdose. So it's a new model, and it's working. I do think that it would be very nice if individuals could stay a little longer, and I know that's a legal issue, because the jail, as the Kentucky model showed, allows for individuals to pause on their intake of use, and then it allows us professionals to continue working with them in the process of recovery. With regards to testing homeless individuals, I would say that may not be an approach that we use. We do have testing strips for fentanyl. We want to make sure that whatever they're using is safe to use. But the models that work with the homeless population is harm reduction models, where we work with them and meet them where they are. Not everybody is ready to go into treatment, but if they are ready to go into treatment, we will take them right away.
And thank you so much, Fatima. And I would also say is that in terms of just randomly testing folks who are unhoused, that would not be something that would be regularly done. I think that if someone is entering a program, then some programs might offer some testing model, but that's not something that's just kind of done at random for individuals who are unhoused. But I know in Richmond, what we have done is to try to offer treatment services, working with AOD. For example, at the Castro encampment, they just did a Narcan giveaway, and also instructional to the individuals and the members who live there to be able to provide them with additional resources of what to happen if they need some help, or if they should come across one of their friends in a crisis or their neighbors in a crisis. So there is outreach that's happening that way, but there's not testing currently being done. In terms of the care courts, I did drop some information in the chat, because for those of you who are unfamiliar with the care courts through SB 1338, there is planning that's going forward with Governor Newsom's Community Assistance and Recovery Program. I think at this point in time, unless I am mistaken, it's still in the planning process with the counties to take a look at the pilots. And the pilot counties as of this time are San Francisco, San Diego, Orange County, Riverside, Stanislaus, Glenn, and I think it's Tuolumne County. So maybe someone has some more information about when the other counties will have an opportunity to participate. But as of my understanding, it's going to be piloted amongst these initial counties, and then there will be additional counties that will be added to the care court model. Am I correct?
Correct.
All right. It's always good to know your stuff. So I wanted to make sure that we got a chance to answer that particular question. I also want to make sure that we get a chance to answer a couple of the questions in the chat. Some of them have already been answered. So the question about, is there Richmond specific data for overdoses? I believe Deputy Chief Osorio answered that, but did you want to speak to that one more time, just so you can give those numbers quickly?
Like I said earlier, it's a little hard to separate the specific cause of the overdose. We don't separate out, narcotics, different types of substances. And so what we have to do in our reporting, when we go pull the data, it's based on our impression as a caregiver at a scene. So some of the numbers I had given you was that for calls that we were dispatched for an overdose, which doesn't capture everybody, but that's somebody on the phone said, my family member overdosed, or I just overdosed and I'm starting to feel bad. That's when that would be the first impression. So on those types of calls, we average about 50 of those a year. In the numbers we've pulled since January of 2021 till last week, it was 117 incidents that we were sent based on that reported problem for a patient. But you have to look at all the other data to try to validate it. And what really seems to be a better way to figure that out is we look at the Narcan administered by us, and we also track incidents where Narcan is administered prior to our arrival. And that could be by a law enforcement individual, it can be by a family member, it could be by at a clinic by a healthcare professional also. So if we look at the number of times in that since January of 2021 till last week, Narcan's been administered 92 times in the city of Richmond. I broke down some of those call types even more. And from what I could tell, we had, of those 92, 81 of those, pretty high confidence level that those were overdoses. There are a few other medical issues that you could have. Just to give an example, if you can go on a CPR and it's unwitnessed and we don't know why, one of the protocols would be to give Narcan if we can't rule in any other cause, just in case it was an overdose. So there's a few of those that may not have anything to do with an overdose, but Narcan was administered. So when you pull those out of the data set, we're left with about 81 incidents in the last 2.5 years that with high level of confidence were overdoses. And it looks like about in the high 70s, all of those were transported individuals, which means when they left the scene, they were still alive or they were conscious and getting further medical attention. We don't have data as far as deaths though, because we don't determine cause of death. So that would be inappropriate to speculate about the number of deaths, at least from the fire department's data that we can pull.
Thank you so much for breaking that down. I think that's a question that a lot of people ask, and that was a great question. We had a couple of other questions that were answered in the chat. I just want to go over them briefly. Someone asked, is there a shelf life on Narcan? Thank you so much, Mariela. You responded and said that the shelf life for that is up to a year after the listed date. And then there was another question is, what does Narcan do that it can save someone from overdosing? And it's basically an antidote drug that reverses an overdose of any type of opioid. And what you heard today from the panelists is that Narcan is also available free to the public. There are oftentimes, trainings and also, provisions of those. And I heard from Mariela that there's also maybe some opportunities at some point in time, not yet, where it might be available over the counter if people want to keep it on hand. So it's obviously a very important tool for us to be able to have in our communities, to be able to have access to Narcan. Looking at the rest of the questions, the only other question that I see right now, and I know we're getting a little bit short on time, and I appreciate everybody's attention to this, is an anonymous question that came in about training. What kinds of training? It sounds like training is really important cross systems for, the fire department, for the police department, training that is shared with the DA's office and AOD and the school district. Are there joint training opportunities available or cross training for our systems?
I think I'll start by just saying there is not such a training modality that is set up like that I'm aware of. I do know that police and fire and law enforcement and medical fields, we do have very similar training. Some go obviously more in depth than others do, but there is basic training in relationship to like Narcan, administering a Narcan, identifying folks who might be either under the influence of an opioid-based drug or an amphetamine, or someone that might be having an overdose a situation. But to answer the direct question, no, I am not aware of any cross-training where all of those systems, all of those agencies and organizations are all coming together under one system or roof to learn the same thing, primarily because of everything's very technical and specific, and not each of these service models need to have the same level or operate under the same level of application. So it would be kind of difficult to have structured training in that way. Not impossible, just difficult and maybe challenging.
Thank you for that. I don't know if anybody else wanted to respond to that.
Yeah, I can chime in a little bit, Michelle. I think what we need to look at is that we're all in we're in related fields, but very different disciplines. And so the agencies that govern what we do, there's natural separation. So there's a lot of training that goes on across agencies that do similar disciplines. Take, for example, fire and ambulance services. They're governed by the health departments, the EMS division, and there's countywide protocols that we all follow. So what we do here in Richmond is done in Brentwood, Oakley, and is done in Walnut Creek and Martinez. So in that sense, there is cross-training, and there is a common approach to this countywide within our discipline. But the rules for my personnel to administer, let's say Narcan, are very different than law enforcement agencies. Totally different set of rules, and those rules are governed or have implications into the license or certifications that you have for your employment. So each of us have our own set of rules we have to play by. And so that does limit some of the cross training, because what we learned in the fire department and EMS service would not apply to a law enforcement field, and it's different than in, say, the county jails. So very different aspects of the same problem are being addressed from different aspects.
Thank you so much. Appreciate that. And I think the structure of this person's question was really more about information sharing, kind of like what we're doing today, cross systems. I don't think it was necessarily the technical training piece of it, if I understand it correctly, but I appreciate both of those responses from public safety. So I think we have come to the end of our time. There's a couple things we want to do is we want to be able to, if anyone has any very brief last words that they'd like to share with anyone, you know, maybe a sentence or two, I'll go through and I will take those. And then I hope that everybody could stay on just 1 minute more. We have a quick poll to do at the end of this. It won't take very long at all, probably take you maybe a minute. And then we will close out. But I'm going to go through last words and I'm going to go in the order that we started. We talked about the challenges and opportunities, you know, just briefly, maybe Assistant Chief Simmons, any opportunities that you see or takeaways from this forum?
Just look around your homes and think about where you store prescription medication. If it's in your kitchen, if it's in your medicine cabinet, or just on your desk, your dresser top, perhaps store them in a more safe location in the event to prohibit the wrong person from getting their hands on it and accidentally overdosing. And if you don't need those particular drugs any longer, do your absolute best to get rid of them. Don't just hold on to them just in case. And I'll leave it at that.
Thank you so much. And Fatima and Mariela and your team, any final words?
From me, from Alcohol and Drugs and Health Services, the perspective shared by DA Becton about utilizing the public health approach. I think that the opioid crisis is going to take a collective approach. Not a single one of us is going to resolve this. We all need to work together with the schools, with law enforcement, with safety, to make it work and make our community safe. But the biggest remark I have is that if somebody is using opioids, it's because they need help, and we need to treat that. And unlike the majority of the drugs, there is medication for opioid use disorders. And Richmond is very fortunate that we also have a treatment facility in your community. You have residential and detoxification services. Locally, you have outpatient services. So referrals to treatment are important.
Thank you so much. I appreciate that, Fatima, your participation in your team. DA Becton.
Thank you. And I wanted to clarify too, because when we talked about those who might be in custody, most likely those who are in custody who are able to avail themselves of treatment are probably in custody for something else in addition to having a drug addiction problem. And so it's great that we have the resources to be able to treat those addictions in our facilities. I think other than that, I would only wrap up by saying that I think we know that we have a crisis in our communities, and we all have an opportunity to work together with our communities and with other partners that are here in the room so that we all work towards the same goal, and that is reducing the deaths from fentanyl and other drugs.
Thank you so much, DA Becton. Appreciate you for being here. Lieutenant Lopez.
No, I'll make it quick. I just want to thank everybody, the panelists that came, the partnership that we have throughout the county and the community. And again, we're committed to trying to solve this crisis one step at a time. So thank you again.
Thank you so much, Lieutenant. Deputy Chief Osorio.
I'd just like to thank everybody for giving us the opportunity to be able to kind of share what we do in the community, and ask that make sure if you have a family member that's at risk or yourself, take advantage of the opportunities for the Narcan programs. You know, it's one of those things. It's there because it works, and we need more people to take advantage of it, and it helps us to better serve once we get on scene. So please take advantage of these programs. If you have any questions, feel free to reach out to the fire department. We can point you in the right direction as far as a Leave Behind program or to the county health program. So thank you.
Appreciate everyone who worked to do this. People have asked, is this going to be recorded? Yes, it was recorded. It will be rebroadcast. It's going to be rebroadcast on KCRT. We'll also put it on our City YouTube channel. And we also will share the link on all of our platforms so that people who were not able to attend can watch it again and again. That's the beauty of recorded programs, is that you can continue to share the information. Hopefully you all will take something that you've learned and share it with someone who you know and you found it valuable. So I really appreciate everyone for being a part of this, and everybody, especially the panelists who gave up their evening to participate. And also thank you to Councilmember Bana. And thank you also to our city manager, who I know was in attendance earlier. So.
Thank you very much, everyone. The city of Richmond is very much caring about this issue, and also the side issue, which is homelessness. 3 of us are going to Texas to see the Community First Village, to see how they're tackling the issue. So we're trying to learn as much as possible. We need everybody's support and collaboration. And thank you so much for all the great work you're doing. Thank you.
Thank you.
Thank you, everyone. I hope you have a wonderful evening, and we will have our next crime prevention roundtable next month, same place, same bad channel, as we like to say. I think we're trying to secure animal control, which I know will be a popular topic. So please stay tuned to that, and I hope you all have a good and a safe night.